Anything you want to plug, anything you want to encourage. Students, get involved. Welcome to the Hank Cisco Show, ladies and gentlemen. Okay, hey, don't touch that dial. We're going to have a home visit. You know, doctors come into your home. Years ago, they used to have a little briefcase and come to your house. Now we're coming right into your home with a physician, a doctor, a surgeon, okay? And we're going to talk about cancer, okay? And predominantly most about breast cancer and different kinds of cancers. But right now we're going to focus in on with Dr. Lori, okay? We had her on here before, but a half hour is not enough for Dr. Lori. She has so much knowledge and so much information to pass on that we're doing in a couple series. So she has one of her medical students here, and I'm going to turn it over to you to introduce her. Well, let me introduce you. Your name is
Christine DeForest.
Okay, and you're a medical student.
I am. I'm a medical student at Philadelphia College of Osteopathic Medicine, and this month I've been rotating with Dr. Lori at Mercy Suburban Hospital.
Okay, now, tell me what she does, and what do you do? Okay, you're a surgeon.
That's right, Hank. You know
Okay.
I'm a breast surgeon. I've been
breast
here
surgeon.
before.
Okay, over here, right?
That's right.
Okay.
Belly
right.
button up. I'm
Over there,
uptown. I'm
over
an
there.
uptown surgeon.
Like the one, the guy tells a
That's
joke.
right.
He says, I saw this girl walking down the street like this. Wow, she's had arthritis in her hands. It's an old joke. It's an old joke.
It's
So
still
go ahead.
funny, though,
All right,
Hank.
go ahead.
I
Tell me all
diagnose-
about it now. You are a surgeon.
I'm a surgeon. I diagnose and treat benign and malignant diseases of the breast. So women that have abnormal mammograms, women that have a lump in their breast, women that have had a mammogram that have found an abnormality, or their doctor got a result, you know, that said, oh, your patient has to go see a breast specialist. That's me. That's what I do. And Christine is a student where I went to school at PCOM. That's how we abbreviate.
Where's that?
That's on City Line Avenue. It's Philadelphia College of Osteopathic Medicine. And as a medical student, which I'll let Christine talk a little bit more about, we have didactics, we have classroom training, and then we also have externships, we have rotations. So she's spending an elective rotation seeing what I do as a breast specialist.
You encourage students.
Absolutely.
Right.
Mercy Suburban Hospital, right down the road, which is where my office is.
That's the one that's going to stay here.
The one
right?
that's going to
They're not
stay
moving,
here.
Right?
We're not going anywhere.
Here we go, baby.
We've been here and we're staying here.
Right,
That's exactly
okay,
right.
right.
We encourage training. We have internship and rotating internship where that's your first year out of medical school. After 4 years of medical school, you have a rotating internship where we teach you how to be a physician. You're a doctor, but you learn all the different disciplines of medicine, internal medicine, pediatrics, family practice, OBGYN. That teaches you how to be a doctor. Then your residency is where you specialize. We also have residencies in family practice, internal medicine, general surgery, and OBGYN. So we are a big training institution. We train doctors, that's right. And in training doctors,
you're the top shelf, right?
You got it.
Right, okay.
You got it. And
And
so
you encourage. Now, just hold it a second.
Sure.
Now, we're at Norristown High School, and there's students here that are going to
That's
be
right.
graduating, going into
That's
college.
right.
Now, let's say that someone's listening, okay? Say, geez, I think I
hope a
want
lot
to do
of
what
people
you
are
do.
listening,
You know,
sure.
what would be some of the courses or some of the things you'd want to start preparing yourself for? You know?
Well, you got to have the desire. And Christine, you could probably
You got
talk
it
a
there.
little bit
You
more.
gotta
You
have the
gotta
desire.
have the desire.
Right.
Anybody can do it. You
Right.
just got to want to.
Right.
Wouldn't you
Right.
agree?
Definitely, it's something that you're interested in from the start. I wanted to work with people, I wanted to work with my hands, and I wanted to help people. And
Right.
so that's why medicine has been a perfect match for me. And it's a long process going through medical school and then going through the different levels in the hospital to get to where Dr. Lori is now. But if you have that desire,
Right.
then that's all that it takes.
You know, Newt Rockney was one of the coaches for Notre Dame. And when they asked him one time as a coach, Coach, what do you look for in a football player? Do you look for a guy that can hit the line and strong? Are you looking for a guy that can pass? Are you looking for a guy that can catch the ball? He says, I'm looking for the guy that has the desire.
That's right.
If he has a desire to play, that's the guy I want. And then he'll learn, okay?
right.
So if you have the desire to become a doctor, a lawyer,
That's right.
a policeman, whatever, you have to have the desire. If you don't, go pack a lunch.
That's right.
Absolutely.
Okay? So I see you have the desire. I can just, just see it. I'm 84. I don't know if by the time I got 14 doctors along there. Right, Doc? But that is great, but how many other people? Do you have other students there?
Sure. We have students that train in all those disciplines too.
In
Now,
different areas,
That's right. Now, Christine is spending a month with me. Before she got here, she was on a different rotation. She was training in obstetrics and gynecology. And when she leaves this month with me, she'll go join an internal medicine service, and she'll spend a month doing that. And I'll get a different student.
In Montgomery, Suburban?
Maybe she'll stay at Suburban. Maybe she'll go to a different hospital,
okay.
because you learn different ways.
You like it around here?
I do. It's wonderful
Stick
that
around,
we
stick
have
around.
it.
Yeah.
It's a great teaching hospital to be at, and it gives us the opportunity
Right.
to experience working with patients. And so we're also grateful to have a population here that allows us to learn from them too.
Right.
Our patients
You
here,
talk
Hank,
like
are
a
very...
nun. She talks real nice and easy.
Yeah, not like us, Hank. Not like us.
All right, so, but now, let's talk about your profession, okay? A lot of advancements.
That's right.
Now, what's the difference between a regular X-ray and monogram?
Mammogram?
Mammogram?
What I
and,
wanted
and
to-
a digital.
What I wanted
a digital
to talk
camera,
about,
you know?
right? Well, what I wanted to talk about is, because a lot of people don't realize this. At Mercy Suburban Hospital, we have digital mammogram, and digital mammogram is state of the art. We talk about state of the art, best you can get.
Is that one of the only around here in this area?
It is. A lot of people talk about the other hospitals in the area. Oh, I go to, this hospital and that hospital, and I get, good care here and there, good care there, and I'm not here to say this hospital isn't good,
Right,
that
right.
hospital isn't good. I'm here to make sure that
You want to beat your chest what you have here.
I'm here to support and tell our audience
Right.
that they need to make sure that they're getting the best care possible,
Right.
and they're getting state of the art. State of the art is at Suburban Hospital. Mercy Suburban Hospital has digital mammography. Mammography is not 100% sensitive, meaning any abnormality that can happen in the breast is not picked up 100% of the time with mammography. However, the best chance you have of finding something on a mammogram is going to be found with digital mammography. So you need to have digital mammogram. Okay?
That really tells the whole picture.
It's very clear. We can see skin edges. We can see blood vessels. We can see any of the most minute microcalcifications. That's the most common abnormality found on a mammogram. That's the most common thing found with a abnormal report. If someone is told that they need to have a breast biopsy, that's what it is. It's microcalcifications. Old analog X-ray films, like a regular chest X-ray or a hip X-ray.
That's what I gotta get.
Exactly. You've got to get a hip X-ray.
replacement.
It's pretty, it's nice and kind of shaded and soft, but it doesn't give us a lot of information, whereas the digital mammography,
Yeah.
in addition to being very clear, the technology allows us to zoom into areas that we want to focus on and change the contrast of the picture so that we can see more clearly.
Yeah.
It's really important, and this is not a predetermined thing that you have to get special insurance coverage for. You can go anywhere. Make sure when you're making your mammography appointment that you ask, do you have digital mammography? Because you deserve to have digital mammography.
You go to the store, you want to get a sirloin steak, a tenderloin steak, right?
Or do you want to chop?
Or you could get a
That's right.
hamburger,
That's right.
okay?
That's right.
But get filet mignon,
That's
the best.
You deserve the best, right?
All right,
There's only
now,
one
and then
you.
there's a lot of differences, okay? So we got the screening and the diagnostic.
That's
Now,
right.
That's, the screening, is that a different
That's
process?
right. That's right, Hank. Screening is what we go every year. We have to get a screening mammogram every year. We take a look at both breasts to make sure there isn't anything going on, but we're not having any symptoms. There isn't anything wrong. There isn't any abnormal symptoms. There's no lumps. There isn't anything that we found that's abnormal. So we're just going to go for the test every year and make sure. There's two pictures we take of each breast, and we go on our merry way. A diagnostic mammogram looks a little more closely at a certain area where we may be having a problem, a lump. There's an area of abnormality. The difference between the two at Mercy Suburban is a screening mammogram, you get your picture taken and off you go. If you're going to have a diagnostic mammogram, a test taken because you're having a problem, there's a breast imager, a radiologist there looking at your test right then and there, and he or
Same
she's
time.
going to come and talk to you and tell you either, you know what, we looked at the test, everything's okay, rest assured you're going to be fine, or you know what, I see that area that you're talking about, why don't you go see Dr. Lori, why don't you go see a breast specialist and have them have a better look at this, maybe this needs a little more investigation.
Right.
Then you have an answer right then and there. You didn't leave without some sort of plan for what's
Right.
going to happen.
Education removes fear.
Absolutely.
Okay.
You're always afraid of what you
Right.
don't know, right? You're
So-
always afraid of
and
what you
they
don't
say
know.
an informed nation is a peaceful nation.
That's
You know,
right.
your mom must be real proud to have twin daughters, and one's a lawyer, or one's and you're studying to be a surgeon.
That's right.
I mean, that
That's
must
right.
be really
I have
she's really proud mama, huh?
Yes,
And
I
Papa?
do. I have a proud family. They're
And you're from the
pleased-
Pittsburgh area, right?
I am. So I was born and raised in Pittsburgh, which isn't too far from, staying in Pennsylvania, coming over to Philadelphia. And it's,
It's far if you're an Eagles fan, isn't it?
Yeah.
well, it
Well.
is, but if you're a Steelers fan,
That's right.
then it
Boo.
becomes
I always
far
tell
too.
a joke. I said I went bowling one time at Pittsburgh is a great union town.
Yes.
I went bowling in Pittsburgh, and I got the ball and threw the ball down and knocked all the pins down. I howled strike. Everybody walked out. Well, I don't know. That's about Pittsburgh.
Where'd you get those jokes?
But I would say that there's a lot of advancement in this breast cancer, and
That's right.
it's I mentioned before. The doctors say you have cancer. It's not a death sentence.
That's exactly right.
That's when you have to start marching. That's when you start asking questions, just like you said. Now, what's the when does someone have to really start looking to get any kind of what they call ultrasound and all?
Okay.
When they get that have to go to a tea party and somebody say, oh, you ought to get a test, or should they touch and flip or what? I don't know.
An ultrasound is usually used when either somebody feels a lump or if they have a mammogram and there's a round area usually referred to as a mass. If you have a mammogram and it looks like there's an area on your mammogram that is referred to as a mass, anything that looks like a round area, a lump or a mass, the radiologist or your breast specialist, like myself, will recommend that you get an ultrasound. An ultrasound is the best type of test that will give us more information about that rounded area, that mass or lump. Is it solid? Is it fluid-filled?
Right.
Is it completely round? Does it have jagged edges? How big is it? Where is it located? That kind of thing. Is it scary or is it not so scary?
Right.
And then we'll usually want to get a biopsy of it from there.
How do you tell someone, you take all the tests, then you bring them in, and then you have to tell them that they have cancer? How do you do that?
Well, Hank,
How do you prepare
a
them, or
lot of people
what
ask me.
People faint, this, or that, they
you know
cry.
what? Everybody handles things differently,
Yeah.
and this is something that Christine
Is that
learns
part
a
of your
lot.
training?
Sure.
is, definitely.
What do you do?
It's something that she learns from me, and I'll tell you from start to finish. Somebody comes to me, and they've had an abnormal test. So they come to me with abnormal
Abnormal
study.
means you got cancer.
Well, it's abnormal.
Well,
they
it's
haven't.
abnormal.
We don't know yet.
Okay.
And so I examine them. I go over the test with them, and I usually recommend a biopsy. So I perform a biopsy on them. I usually have the answer in 24 to 48 hours. So they don't have to wait long. It's not like years ago. Or even at some other institutions, you have to wait up to 4 days to 7 days to get an answer. Not at Mercy Suburban. We have pathologists who are dedicated to, they can appreciate the fact that when you think something's wrong, you don't want to wait 5 days. You don't want to wait 7
right,
days for an
right.
answer. So we do our best to make sure that our patients don't have to wait. I do a biopsy on somebody today. I have an answer tomorrow, which is nice. So that patient is waiting for me to call them back, and I promise them, as soon as I know, you're going to know. And no matter what the answer is, we're going to sit down and we're going to talk about what we're going to do. If it's good news, I call them and I tell them, "Hi, Hank, how you doing?"
Right, okay.
Good? Yep. And so, I'm doing great, and so are you. Your biopsy came back fine. This is what it is, this is what the results showed, and this is what we need to do. Or, unfortunately, I got your biopsy results back, and that did show a cancer. Why don't you and your loved one, your family member, your friend, whoever you want to bring, I want you to come into the office. Let's sit down and talk about how we're going to take care of this, what our next steps are. People handle things differently.
Yeah,
You'd be surprised.
Well, I was pretty active. I was a former professional fighter. I refereed professional fights. And I was a policeman, I motorcycle, walked the beat, I did everything. I've been around a lot of corners. And every time I took a test or something, I was always come out good. Then I took this test, the colon, and it came out okay. Next time I got one, doctor called me and he says that you got cancer. Well, I hear so much about it, and I didn't cry. I just looked and I says, well, what do we do, And then the point got that, what hospital are you going to go to? And he says, what doctor you want to go to? That's my decision. I had to make a decision.
Right.
And then they said, go to Fox Chase, go here, go there. And finally, I talked to Dr. Grafey, since he was a...
Sure.
So I said, well, look, I'm going to stick here with Montgomery. I drove motorcycle and emergency wagon, Montgomery Hospital,
Sure.
So if I'm going to go in Norristown, So I did, and then I got prostate. So 2 times I've been confronted with a doctor telling me, and it sort of prepared me, for a battle.
But
But
you saw
it's not
so
a fight
much
where you
of
got to
it.
fight.
It's different when it
way of
happens
battle,
to
right.
you, and everybody handles it a little
Yeah,
bit differently. It's different. You saw all that.
Right.
You were a fighter. You took care of people
Yeah.
who were sick, right? Driving the
right.
emergency.
And-
but it's different when it happens to you, and everybody handles things a little bit differently.
Like I said, when I drove the emergency wagon, people were crying, and help work right with the doc, putting them on the table, and So I prepared myself, and I think people have to prepare themselves in life. It's tough decisions, but hey. Thank God I'm 84. I'm bobbing and weaving, slipping and sliding.
That's right.
I'll take on anybody 84 my weight.
Nothing got you yet. Nothing got you yet, right?
But okay, now about the MRI. What's the scoop on that now? There's so many MRIs, MRT, and it's beep beep boop bop. And, what's the scoop on that?
MRI for the breast, there's a lot of talk about it because MRI, everybody wants the newest, best, greatest thing. And 10 minutes ago I said that we deserve the best. We deserve the best. We
right.
should have the best. We should take care of our bodies the best way possible. And our hospital has made a lot of new advancements, and we're constantly trying to take care of people the best, most technologically advanced way we can. We have MRI at Mercy Suburban, and we used breast MRI, but we use it in an educated manner. We don't get breast MRIs on every woman that comes in the hospital for 2 main reasons. Number 1, MRIs are very expensive.
They're what?
Very expensive. Number 2, they're not very specific.
They're not as good as the other.
Well, they pick up everything. They pick up everything.
Yeah.
So
ingrown toenails and everything.
you
right?
got it. You got it. If you got poked real hard in your breast 10 years ago, it might show up.
Yeah.
And then we're chasing things that aren't necessarily
Yeah,
important.
and you're not looking for that right now.
That's right. So you have to be educated in the way that you use breast MRI. The way I use breast MRIs is a woman that's already been diagnosed with a cancer in her left breast. I need to make sure she doesn't have other areas in that breast
Yeah.
or in her opposite breast when I'm planning for a surgical procedure.
Well, when a woman gets cancer, does she get 2 breasts at one time or one?
Sometimes. There's as high, anywhere from 4 to 10% of women, when they're diagnosed with a cancer in one breast, will have cancer in both breasts. Anywhere from 4 to 10% of the time.
In other words, but most of the time it's
Most of the time it's in one breast.
just one, and then
Some of the time
finds
it
its
can
way.
be in more than one spot in that same breast. So we have to be sure. The goal is to go to the operating room only one time. That's
The
what we like to
latest
do.
thing on women's we're talking about breast cancer, what's the latest thing? Is it digital? Is that?
Digital mammogram, breast MRI in surveilling, or
Breast
keeping an
MRI.
eye, breast
Yeah,
MRI
not the
in
whole body.
surveilling, that's right,
Right.
not the whole body, in surveilling high-risk women. So maybe the daughters of women that were diagnosed with breast cancer at a young age, in their 40s, okay, their daughters, who are now 30 years old. Maybe we want to catch it before it catches us, okay? We do something called oncotyping, which is a fancy word for. All of the treatment that we do for breast cancer now is based on data from years and years of treatment of
okay.
various women. Now we have a way to take a certain woman's cancer, we test it, and the information we get from this test will tell us if chemotherapy will benefit that woman based on her cancer. So it's actually personalized medicine. Really interesting.
Right.
Very interesting. That's the newest thing. We also do what's called partial breast radiation. We used to radiate the whole breast. If there was an area of cancer this big, we take that area out, take a rim of normal tissue around it,
Right.
but we'd radiate the whole breast because that's what we knew. Now we know that 80% of the time, if a breast cancer is going to recur, it's going to recur in that area in which it first appeared. So we give most of the radiation just to that area. That's called partial breast radiation. Those are the newest things that we do in treating
You
breast
know,
cancer.
my father had a shoemaker shop on Main and DeKalb Street in Norristown, and we all, the whole family, we had three brothers and four sisters, and, well, the four brothers, we all worked in a shoe shop and all, and we had a shoe shine stand, and I shined shoes, had 5 shoe shine stands, and I remember it was Dr. Jenkins, who was a surgeon, you know, and I remember he used to come in, always to wear gloves. He always wore gloves, you know, and I said, well, you know, it's summertime, you know. But I don't know, but your hands as a surgeon is very important, right?
That's right.
Because you're turning, twisting, and...
Well, you're feeling.
What's the story? Is there training that?
Yes.
Do you have to strengthen your hands?
Well, it's not so much that you strengthen your hands, but you get a lot of information from what you feel. What you feel and what you see has a lot to do with your assessment of a situation when you're a surgeon.
Like let me see your hands. Okay.
Well, see, I'm in the learning process. See, that's one of the important things about being a medical student. You start.
Is there something about training or strengthening your hands?
It's experience. I mean, it's experience. It's knowledge. It's, you know.
Well, like you use a knife, you
Repetition.
use a knife, you use a scissors. You
use a
but you-
lot of instruments.
Different. So your hands are just almost like a piano player.
Almost.
And-
You use a lot of tactile things, too. You touch things a lot.
Touching, like
Tissue.
stitching and stuff.
Tissue.
Hey, I got all nervous. I remember some time when I had to bring an emergency, or grab an emergency wagon, you know, a guy would be bleeding and all. And the doctor would say, hold this guy, because the guy was half loaded, you know. We had to hold him down while the doctor stitched, you know. And I couldn't stand that stitching stuff, you know.
No.
But, so, you know, and how long you been doing this now with this
Well-
internship? I can call it intern or what?
Extern.
Yeah.
I'm an extern, so there is an internship, and I'm not quite there. I've been studying for 3 years now.
3 years so far.
3 years so far. I start with 2 years of purely book and lecture and learn from some great teachers at PCOM. And then in my second set of 2 years, so my third and fourth year now, I learn from doctors like Dr. Lori, and
You go in the operating room with her?
I do. So
Yes.
at Mercy
You hand her the
Suburban,
tools and stuff?
they let us.
Rake, shovel?
It's learning the names first. But it's checking the palpating, feeling what these tissues do that get my hands seasoned for becoming a full doctor. So
She
I'm
learns
learning.
from me.
Yeah.
She kind of watches what I do.
And how long now, we mentioned, how long you been now doing this here?
A little over 6 years.
6 years. And you've been here at Suburban?
I trained at Suburban. I left to do a breast fellowship, and now I'm back. I've had my own practice since August.
Right. Do you have your own office?
Yes,
In the hospital?
that's right. I'm in Suite 203.
And we talked to John Doyle. We're going to come out. We're going to come out and do a show.
That's right. That's right.
At your
In
your
Suite
office and
203
go
at
through
the
an operating room and
That's
we're not
exactly
an
right.
actual operation, but the whole operation, how you do it. So, okay, the half hour is over, and great. And now I want to. Now you were on the Cisco show, so we got thanks for being on, and this is our little token for being on there. So
thank
put that in
you.
your office, okay?
Yes, I will.
And so I want to thank you very much.
Thanks, Hank.
Okay.
Thank
Dr.
you.
Laurie is she's our Dr. Phil. Okay. So, ladies and gentlemen, keep at channel 28. We're going to be visiting the hospital. We're going to be talking more about health. One of the most important things in life. Take care of your health. And until we meet again, keep bobbing and weaving, and then Allah Salud to your health. I can't think, right?